Both the Environmental Protection Agency and the Centers for Disease Control and Prevention say there is no known safe level of lead for children. Lead exposure can bring on quite a few health defects, but there are preventative measures that you can take to reduce your risk. Joining us now with important health information is Dr. Judy Aschner, who is the chair of pediatrics and physician-in-chief from the Joseph M. Sanzari Children's Hospital at Hackensack University Medical Center. Dr. Aschner, we so appreciate you being here. An important topic and scary, quite frankly, for a lot of people living in Newark. Where should their level of concern be?
Yeah, so lead is not
Get her mic.
for anybody of any age, but the greatest risks clearly are for young children and for pregnant women and their developing fetus. The exposure in Newark is still being investigated. It's unknown whether people have elevated levels because of the contamination in the water. The filters that were put in people's homes were certified to reduce lead levels, but some of the recent tests have suggested that they haven't reduced them as far down as was anticipated.
Okay, so let's go ahead and walk through some of the side effects that people may experience so that they know themselves what is happening. Let's begin with children. What are some of the things that could pop up that a parent really needs to be cautious about?
Yeah. So as was mentioned earlier, there is no known safe level for children of lead. But most children who are lead exposed and have elevated levels are asymptomatic. So if you are living in an area that is at high risk, and that includes people living in older housing that was built before the 1960s, and certainly lead was taken out of paint in 1978, or if you have concerns because you know that the lead levels in your water have been elevated, testing is important. And testing is particularly important for children up to the age of 3. Lead levels really drop quite precipitously after the age of 3, but early exposure can result in lifelong impacts. The effects of lead on children include altered school performance, reduced IQ, changes in behavior, hyperactivity, and then there are effects that are seen only at higher lead levels. Abdominal pain, vomiting. This is pretty rare today. It was much more common 30 and 40 years ago.
And you mentioned that some of the effects then can also transpire in adults. You see it maybe be affected as a child. What are adults looking for and what can they expect?
Yeah. So as I said, the highest risks are to children because they have developing brains that are particularly vulnerable. But adults who are exposed as children may have hypertension and altered renal function, and high lead exposure to environmentally exposed adults can cause further health problems, including mood disorders and further damage to their kidney and cardiovascular effects.
And you mentioned fetuses and women that are pregnant. What should they then be looking for, or what are some of the effects that they may have?
So people who are anticipating pregnancy or are early in pregnancy and live in housing where they are concerned about lead exposure should have their houses checked and can have their own blood level checked. It's clear that elevated blood levels of lead in pregnant women can affect the fetus. The fetus will have the same level as the mother.
When you talk about some of the things that we need to do for preventative measures, what do you suggest to your patients that come in? I know you mentioned checking on your own, but is there anything else that they can be doing?
There are a number of things that you can do. Interestingly, this crisis is about lead in the water, and this is a serious problem and needs to be addressed, and if elevated, needs to be mitigated. But for most people, the greatest lead exposure remains in the soil and in the dust from older housing that used to be painted with lead-containing paint. And so more than 50% of children's lead levels come from that source. 20 to 50% can come from the water if the water lead levels are extremely elevated. So there are some things that people can do if you're concerned about lead in your water. One is to have it tested. There are some recommendations to run the water for 1 or 2 minutes before using it. But again, if you have lead in your pipes, that may or may not help. And it's important to check the lead in the water both before and after running it for 1 or 2 minutes. Always use cold water, not warm water, for drinking. And people should not be concerned about bathing. Lead does not
saturate
into
through
your
the skin.
body through your skin. It's pretty much all through ingestion. And that's one reason why children are so vulnerable, because at the ages of 1 and 2, they do a lot of hand-mouth movements. They play in the dust, they play on the floor.
And I guess mixtures of formula as well.
So it turns out that lead in most women's breast milk is very low. So women who breastfeed, their children are somewhat protected. In infancy, if you're using powdered formula that you mix with tap water, this can result in a very high exposure for that child. And so if you are formula feeding your baby and you're using powdered formula, it needs to be mixed with water, using bottled water is a good idea.
How soon after exposure can you expect to see some of the effects?
So like I said, most effects are subtle and not often recognized until school age, although exposure occurred very early in childhood. And so symptoms are really not that helpful. It's really doing a risk assessment of the environment where the child lives, and then testing the blood of children who are living in environments at high risk.
Thank you so much for being here. Important information, and hopefully you can apply that at home and keep yourself safe. Thank you, doctor.
Thank you.